Patient notes. 21-year-old male involved in RTA at 3:30 p.m. GCS initially 15, experienced transient loss of consciousness. Hemodynamically stable. Physical examination. Swollen right hand. Left upper abdomen abrasions. Open tibiofibular fracture on the left lower limb. Investigations. X-rays revealed fractures in the right hand and left tibia fibula. Abdominal ultrasound showed a free intra-abdominal collection. Blood tests within normal range. Interventions. Administered tetanus, antibiotics, and fluids. Progression. At 11:30 p.m., the left leg showed signs of acute limb ischemia. Absent distal pulses, paleness, and worsening pain. Immediate attention is required. Tasks. You are the surgical junior clinical. Call the trauma head and update him about your patient. Hello, I'm Fateh, a surgical clinical fellow. I'm calling to provide an update on a trauma case. May I confirm that I'm speaking with the trauma head, Mr. Ahmed? Yes. Summarize your case. A 21-year-old male presented to A&E after a road traffic accident at 3:30 p.m. Despite a GCS of 15 initially, he had a transient loss of consciousness. He is hemodynamically stable with a swollen right hand, left upper abdomen abrasions, and an open tibiofibular fracture on the left lower limb. X-rays revealed fractures in the right hand and left tibia fibula. Abdominal ultrasound showed a free intra-abdominal collection. Blood tests were normal. Tetanus, antibiotics, and fluids were administered. At 11:30 p.m., the left leg showed signs of acute limb ischemia with absent distal pulses, paleness, and worsening pain. Immediate attention is required. What is the most urgent issue with the patient? The urgent concern is the open fracture in the left lower limb with arterial damage risking ischemia and compartment syndrome. Why is the call made? I called for the potential need of urgent overnight surgery. What are the causes of a pulseless foot? Possible causes include vascular injury, compartment syndrome, kinking of blood vessels, and arterial spasm. What's the missed investigation? The overlooked investigation is a duplex ultrasound and a CT angiogram. Is the patient wearing a C-collar? I'm sorry, I'm not sure. I will check and update you. Is the patient dehydrated? I'm sorry, I'm not sure. I will check and update you. How to manage the patient if they arrive in the ER? I will follow the ATLS protocol using the ABCDE approach. What plans of action should be taken? I will inform orthopedic and vascular consultants, immobilize the fracture, and order CT scans. What needs to be done before sending the patient to the theatre? Administer IV fluids, analgesia, traction, and cover the wound without washing. Ensure antibiotics and anti-tetanus are given. What's the approach for wound management? Perform debridement in the operating theatre within 24 hours to reduce infection risk. What are the necessary blood investigations? I will send blood tests for CBC, blood grouping, cross-matching, RFT and LFT. How to fix the fracture and why? External fixation is preferred for initial stabilization, providing access to assessments and interventions. Why was an ultrasound requested for the abdomen? Ultrasound was requested to check for possible splenic injury due to abrasions. Who may need to be contacted before or during the operation? I will contact the operation theatre technician, anesthesia provider, general surgeon, vascular surgeon, plastic surgeon, orthopedic surgeon, and neurosurgeon. Why involve plastic surgery? Plastic surgeons are needed for potential grafting in the case of an open fracture. Why will you contact general surgery? General surgeons are crucial for addressing open wounds, managing compartment syndrome, and ruling out intra-abdominal injury. What's the approach if there's free fluid in the abdomen? Emergency laparotomy. Okay, that's all. Thank you, Mr. Hamilton, for your time. Thanks. Goodbye.